Good day, everyone. My name is Fikar, and on behalf of my team, I would like to present our study entitled Kakak Tumbuh Kembang or Kumbang, engaging medical students for screening and detecting growth and developmental delays in children. Growth and developmental delays have been an issue affecting millions of children around the world, including Indonesia. These problems affect not only the child, but also the caregivers and families, causing the overall decreased quality of life to all parties involved. Evidence suggests that community education and early detection of growth and developmental delays are key factors to mitigate these issues. However, the current COVID-19 situation has disrupted routine programs delivered by the community health centers or puskesmas. Our project called Kumbang or Kakak Tumbuh Kembang aims to provide a new normal alternative in screening and educating for children's growth and development by involving medical students as part of screener in the community. We expect medical students as trained lay people to provide sustainable, valid, and reliable assistance to parents. So why Yogyakarta? Yogyakarta is one of the major cities in Indonesia, mainly known as a city of education. However, despite this enduring title, Yogyakarta is also the city with the highest social inequality in Indonesia based on the Gini ratio. This raised the concern regarding its already low developmental index score compared to the average of Indonesia, that the number might be even lower in areas with low socioeconomic status. So this study aims to assess the project's reach in skirting growth and developmental delays, while also exploring the project's effectiveness through parents' perspectives. Collaborating with the Center for Indonesian Medical Students Activities Universitas Gadjah Mada or CIMSA UGM, we recruited 33 volunteers medical students and trained them with certified pediatrician. The volunteers screen the developmental aspects of children through an online platform. Here we use WhatsApp video call, voice call, or even chats, while children growth screening is performed by the health cadres through offline appointment with COVID-safe protocol. We analyze children's nutritional status using the WHO Anthro Survey Analyzer and children's developmental status according to the questionnaire pra-screening perkembangan guidelines. Parents' perspective on this project was assessed through a survey. A total of 92 under 5 years old children from 4 posyandu in Puskesmas Kondokusuman participated in the project. Around 29% of children had nutritional problems, either underweight, stunted, wasted, or the combination of those problems. In detail, there were 16.3% of children who were underweight, 20.7% of children who were stunted, and 6.5% of children who were wasted. All of these numbers were higher than the reported prevalence by the Yogyakarta city in 2019, which were 8.5% for underweight, 11.3% for stunted, and 5.1% for wasted. This emphasizes the importance of routine growth screening to keep track of the number so that the prevalence of children with abnormal nutritional status can be detected earlier. Meanwhile, 34% of children were at risk of developmental delays, of which 5 were suspected to have developmental delays, while 24 children had dubious results. This number was relatively similar to a study conducted in Bantul, which found a 36% prevalence of children at risk of developmental delay in their study. This implies that routine screening should not be temporarily on hold due to the COVID situation, and a new alternative should be embedded to replace the old way of face-to-face screening appointment. Kumbang project promises a good answer to that. Our study found that the majority of parents felt that this project is sufficiently effective in screening for their children's development and are comfortable with the online screening as it is more COVID safe so that they don't need to go to puskesmas. Parents also felt comfortable communicating with volunteers and believed that medical students could provide valid and reliable information. And in long term, around half of the parents uh, think that it can be done in long term. In conclusion, the Kumbang project offers a good alternative for screening children's growth and development during the current disrupted routine screening. Involving medical students could help service delivery as health professionals are relatively occupied with COVID-19 management. The online method used in this project should be considered as a prospective option for routine screening in the future. Thank you very much for your attention. We are open to your feedbacks. Good day.